Welcome, everybody. I just love that song. I love a good song to start a Facebook Live meeting. I'm Michelle Hughes. I'm the Executive Director of NC Child, and I want to say hello and welcome. Thanks so much for taking some time out of what I'm sure is your very busy day to be here and hear more about the Child Health Report Card. We are really excited to be able to bring you this very quick lunchtime briefing on the Child Health Report Card. Together with our colleagues at the North Carolina Institute of Medicine, we just released the 2021 Child Health Report Card a couple of weeks ago. Our KIDSCOUNT program director, Vikki Crouse, who is one of the primary authors of the report card, is going to take some time today to walk us through some of the highlights in the data and take your questions. And then we will be joined by a very special guest, Rachel Radford. Rachel is a member of our Parent Advisory Council from Wayne County, and she is going to be talking about how to use this data like the Child Health Report Card in her advocacy work and in your own advocacy work. So we are very excited to have these two experts talk us through how kids in North Carolina are doing. And we are, as you all know, on Facebook Live today. And one thing that I just wanted to highlight is that there is a long time lag between when we are talking and when it actually broadcasts out on Facebook. So for those of you who are tuning in today, please go ahead and share your comments and your questions and your thoughts into the chat on Facebook. We will relay your questions to the presenters right away, but there's going to be a little bit of a delay, 3 or 4 minutes from the time that you submit your question and when we are able to answer it. And so just hang in there and have some patience. Before we get into the data presentation, I just want to take a minute to thank everybody. Many of you who are with us today are donors who support our work financially. And I cannot say how important that is and how grateful we are for every one of your gifts. You make this work possible, so thank you. And I want to frame up also Vikki's data by saying I have been working in the field of child advocacy. I hate to say this because it's really long and I'm really old, 25 years, more than 25 years. And while some of these data that Vikki is going to be presenting are bleak, we have also seen really huge improvements in kids' health and well-being in terms of their health coverage, vaccinations, and a lot of other different areas. So we are making headway from when we first started these child health report cards way back in 1997. So remember, change takes time. We need you to make the change, and we are so glad that you are partnering with us to help kids get better outcomes. So thank you for being here today and for your support of NC Child and partnering with us for kids. And now, without further ado, I'm going to turn it over to the expert, Vikki Crouse. Vikki, I will turn this over to you.
Thanks so much, Michelle. And thank you, everyone, for being here with us today during your lunch hour. I am going to ask my colleague to pull up the slides for me on the screen so I can go ahead and jump in. And as Michelle said, change takes time, and we're overall really glad to see progress on children's health. One fun fact about the Child Health Report Card is that it is nearing, I think it's 20th anniversary, 25th anniversary as well. And so this really was born as an effort from NC Child and the Institute of Medicine back in the 90s as a way to track children's health and really push ourselves and our state agencies to make good progress for kids. And one of the things that we see now in recent editions of the Child Health Report Card is that we have access now to more data and data that is disaggregated by race and ethnicity, which is a really great thing because that really helps us be able to measure children's well-being across different racial and ethnic groups and understand, where those racial disparities really lie and what we can do to make sure that we see improvement across every racial and ethnic group in North Carolina. So I'll go ahead and get started. Going on to the next slide, you all can see here a really quick overview of all of the grades that were included and all of the indicator areas that were included in the report card this year. A little bit of context, these grades are assigned by a really great expert committee, grading committee that's made up of public health experts, folks in the medical field, retired state agency leaders, people who really know their stuff and who have been keeping an eye on children's health for many decades. And so one of the things, while we don't have a specific formula for how the grading committee assigns these grades, they take into account not just how kids are doing overall, that single indicator of how, or that single percentage for each indicator of how kids are doing overall, but like I mentioned, they also take a look at the racial disparities that we see, and that really factors into how much we can say that kids are doing well in North Carolina on any one thing. They also take into account the trends that we've seen over the past several years and how they compare to the most recent data as a way to understand whether we are making headway or whether we're going backwards. So it's not all bad news, and I'm going to be delving into just a handful of the indicators that really stood out to us and to folks on the ground. Frankly, we got some really great feedback from advocates who note the indicators that they see in their community from day to day and that we really want to talk about. So we'll go on to the next slide. And of course, we have to celebrate health insurance that got an A, I think, once again. And this is an area that has been improving marginally over the past several decades. And we're really glad to see where we are now. I think approximately 94% of children in North Carolina have health insurance. And we're seeing among parents who are insured, the number of parents without health insurance decreased marginally from the last count. So down to 13.7% of parents who are uninsured. Not where we want it to be. We certainly still need Medicaid expansion in North Carolina, absolutely, because there are way too many folks in our state who are struggling without health care. And when it comes to children, unfortunately, in recent years, we've seen a marginal decrease of kids who are insured, and that's not good because we've been making so much progress. But as you can see in the data over the past 4 years or so, without the support of a federal administration that was really, putting a lot of messaging out there about the ACA and making sure that families were signing their kids up for Medicaid and the subsidy plans as well. What we know from the research is that when parents are insured, they're more likely to get their kids insured in those state Medicaid programs, right? And so when the opposite is true, we're tending to see the effect of that. And unfortunately, the pandemic has meant significant declines in employer-sponsored health coverage in 2020. We know that we've seen a lot of layoffs this past year, and we don't have that data yet. This is all pre-pandemic data, but we're certain to see that wave of impact. Most recently, we can celebrate the triumph of the American Rescue Plan and what that's going to mean for health coverage for years to come. So those are things that we're keeping our eye on as we go forward. All right, we can move on to the next slide. When it comes to birth outcomes, this is a particular issue area that has been disheartening for North Carolina. We know that one of the most important factors in infants' health is their mother's health before and during pregnancy. And in 2019, the infant mortality rate in North Carolina was 6.8 per 1,000 live births, which was a drop from 7.1 per 1,000 births in 2014. But unfortunately, our state still has one of the highest infant mortality rates in the nation, and racial disparities persist. Black moms and Black babies are twice as likely to die at birth than white moms and white babies. So that is something that North Carolina, that our state agencies have been working hard on. We're already starting to see implementation of interventions to tackle this disparity, but that's certainly an area where we've haven't made enough progress, and the numbers are just too high for our folks of color. So we'll go on to the next indicator. And housing and economic security, again, received an F grade, a very failing grade, because we just, too many families in North Carolina, frankly, are entrenched in poverty, and they are missing the supports that they need to get ahead. Even before the pandemic, almost half of North Carolina kids lived in poor, low-income households. And so that is households living below 200% of the federal poverty line. And in 2019, a quarter of children lived in households that were spending 30% of income on housing costs. So what that means essentially is that a quarter of kids were living in households that were housing cost burdened, right? When your housing costs eat into more than almost a third of your income, that means that you have a lot less money to cover your other essential needs. So that's really bad, and also contributes to the levels of homelessness and housing insecurity that we see across the state. And we'll talk a little bit more about what, how that's translating over the past year and the impact that we've seen on housing and economic security because of the pandemic. And finally, just want to highlight tobacco, alcohol, and substance use, which moved down a grade, unfortunately, to an F. And this was largely driven by the increase in usage of electronic vapor products among youth, which is very, very concerning. The good news on this indicator is that cigarette and alcohol use have gone down among youth in recent years. But we know that, we've just seen an increase in popularity in vaping among youth, and with approximately 3 in 10 high school students reported using these products. Recently, we saw North Carolina raise the age on vaping access to youth who are 21 years old. So we hope to see the impact of that new policy in North Carolina in future years. We also wonder about the impact of staying at home more this past year and what that has meant for kids. Maybe they're under more supervision at home than they were previously and don't have the same access to vaping products. But that's certainly something that we're keeping our eye on. So moving us into the special issue, just want to highlight a few things that I know we all are paying attention to and really care about for kids. Obviously, we know that this pandemic has touched every North Carolina family. And when it comes to family economic security, we see that approximately 1 in 4 families with kids struggle to pay rent, while a fifth of homeowners with kids are behind on mortgage payments. So again, touching back to that housing insecurity that we were seeing before the pandemic, now is really hurting a quarter of families with kids. And so that's not good. We also see that 1 in 5 households with kids report not having enough to eat over the past week. Prior to the pandemic, that figure was around 15% of households who were experiencing food insecurity. So we are seeing that slight increase in food insecurity. And yet we also know the importance of interventions that we saw over the past year with delivering school meals to kids where they were, and just the boost to SNAP benefit as well in North Carolina. So that's really great. Great. And when it comes to education, of course, this is something that we are talking about a lot now as we try to get kids safely back into the classroom. COVID-19 drastically changed the way kids receive education, but access to internet and computers remains a challenge for families. Right now, as of December, when we pull the data from the poll survey, approximately 67% of households had moved to virtual only education, and but still over 200,000 households in North Carolina do not have access to broadband internet. So that means that kids are likely doing their homework however they can, oftentimes from a small mobile screen in a parking lot, wherever they can get Wi-Fi. That also means that parents don't have access to internet to be able to apply for things like WIC and SNAP, or even apply for jobs. So that's a challenge and certainly something that we need to address. And finally, when it comes to health, this is something that we have just seen, echo across our communities. As of the last count, almost half of households with children in North Carolina reported delaying getting medical care because of COVID-19. And so, of course, this is concerning because kids aren't getting those well-child visits, those preventative visits that catch really important things. It also means that kids aren't getting their immunizations. And that's alarming from a public health standpoint, because we're not, if we don't have at least a 93 to 94% vaccination rate for diseases like the measles and the mumps, then we can't have that kind of herd immunity and prevent community spread. So we don't want to have a secondary outbreak for a disease that we immunize for, right? So we have to keep an eye on that as well. And more than half of parents are struggling with anxiety and depression symptoms and have not received mental health care for those symptoms. So of course, when we think about child abuse and neglect, when we think about, youth suicide rates, all of those things, that substance use, all those things that can be tied to mental health, we have to make sure, and particularly healthcare access, we have to make sure that folks have the resources they need so that kids can thrive in their homes and in their communities. And so finally, wanted to talk about a few of the opportunities that we see in North Carolina for kids. And a lot of this is what we've been talking about for the past year, and even before the pandemic. We need to strengthen health coverage as a crucial part of North Carolina's public health response to COVID-19. We need to expand Medicaid in North Carolina. We also need to prevent long-term harm by investing in programs that are proven to insulate families against harmful effects of poverty, like SNAP and WIC and the EITC, the state EITC. We're seeing really great signs at the federal level of an effort to invest and boost these programs. That I encourage you all to tune into our Friday call, where you'll learn more about that. But that is certainly work that we have to do at the state level as well. And like I mentioned earlier, expanding access to broadband internet to ensure that these 200,000 households have that resource, because in the digital age, we simply can't survive without internet. And one final plug, with the recent news of the American Rescue Plan, is that our state legislature, which is now in session, is going to be making really big decisions about how we distribute federal funding. So this is a really big advocacy opportunity for us to be able to help our legislators determine how that funding gets distributed and tackle some of those racial disparities that we talked about today. But with that, I will, I actually don't know if we're going to take questions right now, or if we're going to move right on to Rachel.
Hey, Vikki, I think we'll move right on to Rachel. And then once Rachel finishes, we will swing back and answer questions. We're getting some great feedback in the feedback from folks. And I want to kind of circle back after Rachel has an opportunity to talk.
Yes. Thank you all for engaging with this conversation. So I want to introduce Rachel Radford. She's a parent advocate from Wayne County, and she's a member of our NC Child Parent Advisory Council. We're so lucky to have her. And she's also a member of the Wayne Child Advocacy Network. But most importantly, she's a mom of 2 wonderful boys, and we're so honored to have her here with us today and have her share her perspective. So I'll turn it over to you, Rachel.
Thanks, Vikki. Hi, everybody. My sons have autism, so it is very important to me to be an advocate, not just for my sons, but the autism community in Wayne County. For me, I have children with IEPs, so I am very understanding of facts and data are much more important than my opinion sometimes. And so when I'm contacting legislators and I'm contacting people that I want them to hear me, I want them to really, really hear me. They can't just hear Rachel's opinion. Unfortunately, I've got to have facts and data. And some of the great points you brought up, Vikki, the birth outcomes, I'm seeing that in my county. And now I have facts and data to bring it up. It's not just my opinion. It's not just what I've heard in the community. It's not just what I'm seeing. It's all of North Carolina is seeing this. So when I contact my representative, I have facts and data to back up everything that I say. And I do see this in my community, and I am concerned. And as a parent with 2 sons with IEPs, it's just crucial when we go to these legislators, when we go to others, and we're talking about the things that we want to see change in our community, that we have facts and data to prove that, to show that what we are seeing is very true and very real. And unfortunately, we have to have facts and data, because I can tell you all day that the sky is purple, but we all know the sky is blue. And so that's where that facts and data comes up. And that helps take the emotions out of it too. As a parent of special needs children, I get very emotional about my children. I love them so much and I want to do everything for them. But I know I can't be the best advocate I can be if I don't have that fact and that data with me. So this is crucial for me as a parent advocate. This is crucial for me in Wayne County. This is crucial for me to talk to my county commissioners, my city council. It's just crucial for me as an advocate to know this information and know what's going on in my state. I'm not sure where we are with it time, so I can keep talking or I can stop.
Rachel, we would love for you to, if you have any additional comments, please take time. You are such an amazing advocate and have so many things to share. So please feel free to take a couple more minutes and share, and then we'll go ahead and answer some questions after that.
Okay. I just wanted to encourage families that your voice is so important. And I don't want you to ever think that your voice doesn't matter. It always matters. And that's where these facts and data comes into play. Because then my opinion matters, because the facts and data back up my opinion. And the legislator or whoever you're talking to will take you more seriously because you have those facts and that data. And it's very important that when you have an issue that you're very passionate about, that you understand that issue, the good and the bad and all of that, but the facts and data are the most important thing. I want every parent that is watching this to know that your voice is the most important voice. You are the expert on your child, and there is no other expert but you, because you spend 24 hours a day, 7 days a week with your children. So parents, I want to make sure you look at this child health report. This is going to help me in my advocacy as a parent on the Parent Advisory Council for NC Child. This will help me in my county. This will help my state. And anybody who I reach out to, all I've got to do is go back to this printed paperwork, or I could look it online. I like printed material. And it's right there. It's all right there for me. So I just want to encourage parents to know that you have a voice. And this can give you an even bigger voice, because you matter. And don't for one moment think that you don't matter and your voice isn't important, because you are the expert. Thank you, Michelle.
Absolutely. I don't even know how to follow that after that. Like, that is everything that we want to say to you. First, thank you, Vikki, for that amazing overview very quickly of so much data. We really appreciate all your amazing work and are thankful for your guidance as we try to figure out how kids are doing in North Carolina. And Rachel, you and all the parents of the Parent Advisory Council and so many of the folks that are on Facebook Live right at the moment, as you said, your voices matter. Your voices are important, and part of our job at NC Child is really to help give you all the tools and the data that you need in order to be the best advocates for your own children and the children in your community and the children that you are serving. So we really are so thankful, Rachel, for all the work that you do, and folks on Facebook, so thankful for all the work that you do as well. If you have not already signed up at NC Child to get our updates, please do jump on, get connected. It's ncchild.org, and you can join our email listservs, get updates, and get the information that Rachel and others are using in their own communities to hold up what is going on for kids and address the needs of children in their own communities. If you have questions for Vikki or Rachel, please go ahead and get them into the chat. I'm going to lift up a couple that I'm seeing right now. One is some feedback from Joel Rosh. Hi, Joel. It's good to not see you, but good that you are on. He mentions that we really need to do more on housing policy, because recent research shows that zip code is such a major predictor of child outcomes. And of course, housing stability is such a really indicator of good child outcomes. And so that is really great feedback. Joel, you will be happy to know that is one of the reasons that we are partnering with the North Carolina Housing Coalition this year to really increase our advocacy and work in this area. So thank you for holding that up, and stay tuned for more opportunities for you and other folks to plug into that work. We're really excited to do that work. Let me look a little bit before. Want to thank a couple folks and just really some great feedback. Amber Whitley Pierce, yes, you are so right. Adult health is really critical to child health. And when moms and dads are healthy, their children are more likely to be healthy. So yes to that, 100%. David Rockefeller, access to the internet, yes. As we know, having access to the internet is one of the most critical things for kids learning right now, and too many kids across the country just don't, and in North Carolina, don't have that access. So we really need to be looking at broadband and policy solutions for that. So thanks for holding that up. And let me see what else is on here. Let me see. Well, I think that's it for questions. And I'm looking at time. Vikki and Rachel, any additional things that you guys want to hold up in terms of some of the things that people mentioned? And then I will close us out.
The zip code was great to bring up. I see that in my own community, and it really depends where your zip code is, you know, where that access is. Particularly for me, I'm very concerned about COVID-19 shots right now, and making sure those in my community who don't drive and can't get access to those have that access. I would just like to say that yesterday I got my COVID-19 shot because at Walgreens they had extra doses, and someone just came up to me and was like, "Would you like a COVID-19 shot?" And I was like, "Yes, I would," because I'm not eligible until March 24th. So I was so excited. And then I thought about, well, do the people in my community have access to this? Would somebody that's walking everywhere have access to this? And I want everybody to have the same access, and not just somebody who drives a car. So this was, you know, something that I know I need to look into. So I just feel like this child health report is just so important because of all the issues. But I thought the zip code comment was just absolutely great. It just made me think of other advocacy I can do in my community. So I just wanted to lift that up. I really appreciate you saying that. This is something that I feel too. And I'm going to bring that up more now that somebody is bringing it up on here. I feel it's very important. So thank you.
Thank you, Rachel. There was one other question from Renee in the chat. Are there initiatives that are addressing the needs for housing and economic security, as well as addressing the drop in live birth? So referring to infant mortality. That's a really great question, Renee. And on the housing and economic security, like Rachel was sharing, it's all connected. It's one of the social drivers of health. And so when we tackle things like work supports for families, paid sick leave, recently with the rescue plan, the child tax credit as an added direct boost for families with kids. Those are the things that can really make a difference in lifting families out of poverty and making sure they have housing security. With regards to infant mortality, expanding Medicaid in North Carolina is really the most critical thing that we can do and make sure that more moms have access to care and have it early, so that we don't see any more high infant mortality rates in North Carolina.
Great, thanks, Vikki, for all that good information. Folks, it's getting close to 12:30, so I want to go ahead and really honor your time. First, thank you for being part of this Facebook Live event. We hope it was helpful and informative. I want to thank our two guests, Vikki and Rachel, for their amazing work for kids and families. And I want to end with just a couple notes. So let's end with the celebratory note. Y'all, the American Rescue Plan passed. And this is such a transformative, game-changing piece of legislation for all kids in the United States and for North Carolina kids. I've been doing work, as I said, for a long time. I have never seen legislation in this scope that is addressing child poverty, and really is going to be lifting millions of children out of poverty, changing the outcomes for their lives. And this is really important and really huge, and was a lot of work from folks across the country. So for all of you who participated and were part of that, Thank you, thank you, thank you. You contributed to this win. We are going to be celebrating this, not only in terms of child tax credits, but the money that's in there for child care, early care and education, for health and Medicaid. It is really important resources for kids in our communities, and we could not have done that without you. And so that I wanted to mention. And two last things. One, again, thank you for being a supporter of NC Child. We really are grateful for your continued support. If you'd like to make a donation or a gift to continue, to allow us to continue to do this good work, we would be grateful, we would appreciate it. And you can do that very easily by going to ncchild.org and looking for the donate button. Every gift makes a difference, and we are really grateful for your support, so thank you. And finally, again, please sign up and become part of our Child Advocacy Network. We are only as powerful as your voices. Your voices, your work fuel our work. We could not do this without you. So please become a member of our network, like Rachel, and we would love to have you partner with us. If you have any questions, as always, please just give us a call or email. And other than that, we will let you all go with a very big thank you, and stay safe, get vaccinated, and we will see you soon. Thanks so much, everyone.
Thank you.